Dr. Amy Arrington. She's an ICU physician, and we are talking about vaping today. All over the news, you know, the CDC has been investigating hundreds of cases of severe lung disease, potentially related to vaping. The president, I think just yesterday, jumping on board saying that the administration wants to try to ban flavored e-cigs, those cartridges that are very popular with young people. So big topic right now. We're inviting you, our Facebook friends, to go ahead, type in questions that you may have for Dr. Arrington. She's with Texas Children's Hospital and Baylor College of Medicine to talk about all of this. And I think maybe the first question people might have is, people have been vaping for, quote unquote, I guess relatively speaking, many years, but it feels like just very recently we have heard about these hundreds of severe lung illnesses, lung collapse issues, even 5 deaths that the CDC is looking into. So why is it sort of suddenly coming to the, it feels like to us, suddenly coming to the forefront now?
Sure, it feels like that way a little bit to us as well, although we've been talking about it for a while. So vaping and e-cigarettes teens in the past few years. So now the CDC estimates that about 3.6 million kids are vaping. I think what's worrisome is that it's becoming younger and younger. So even middle school children, I think 13% is the estimate that middle school children are vaping. And part of that is how it's marketed. So it's marketed towards kids. They're flavored. They come in flavors like berry and chocolate and bubble gum. And of course, that's not marketed towards you and I. That's something
that's a kid flavor
marketed towards a child or a teenager. And so in the recent months, and I think too, that's going to take some investigation for us to go back and see, have we been missing these cases all along? But we're starting to see kids come in with lung disease that cannot be explained by an infectious disease. So the definition of vaping defined lung disease is to have bilateral or both sides of your lungs affected. You may or may not have x-ray findings. Children who are having coughing, shortness of breath, sometimes wheezing, difficulty breathing, sometimes needing supplemental oxygen, sometimes not, but sometimes needing, being so severe that it requires a hospital admission, sometimes up to an ICU admission and needing
which is where you might see them eventually.
Correct. And then there's other symptoms too, like GI symptoms, weight loss, in addition to that.
Other problems.
Right.
So we hope if you have a question that you'll go ahead and start typing them so you can ask them directly. I mean, this is literally a house call for you. You don't even have to leave your living room or your office desk. But Dr. Arrington can address some of these issues. And actually, I'm going to ask our producer maybe to hand me this iPad over here so we can kind of start monitoring some of those questions. So the CDC has been very active also with this, and they have kind of a list of potential questions for physicians, and you were integral in kind of culling those down so that your colleagues have sort of a template to work with. Tell us about some of those questions that both doctors and presumably parents could use.
Sure.
Yeah.
So we wanted to really put out to our community at Texas Children's Hospital, our community of clinicians, including physicians and nurse practitioners and PAs that see patients in all areas of practice. So whether that's in the urgent care and emergency centers and clinics, or as inpatient, whether that be on any service, what questions do we need to ask teenagers in particular, and then what signs do we need to look for? And we met as a group, both with myself and some pulmonologists and then epidemiologists, but we really took guidance from the CDC guidelines as well as the Texas State Health Department.
And we should say, by the way, those are also available on khou.com, so you don't have to scribble it all down. You can go to the website. But do you want to give us a couple of bullet points, which, you know, maybe the top 4 or 5 that you think can really help both the parent and the physician?
Sure. So I think beyond the clinical, number one, it's just important to start asking and have the conversation. And that may go two different ways depending on whether you're a physician or a parent.
Yeah.
I think for a parent, and I'll say the CDC has a really nicely done website with tools for parents on how do you have this conversation. But it's, I think, just opening that dialogue in a non-confrontational way is
which is hard. I have two boys,
as
but
difficult
yes.
as that may be. But to ask about vaping, how are you doing this? Have you tried it? Just tell me about your experience in wherever you are, high school, middle school, and what's going on. And then you can get deeper into that conversation. What are you vaping? What are you using? A lot of kids are using different things. Juul is the most common e-cigarette on the market. Juul has 80% of the e-cigarette market. I think a really interesting fact to know is when they surveyed teens, almost 70% didn't know that there was nicotine in Juul. So Juul is the flavored cigarette, e-cigarettes that we're talking about, but teens smoke them or vape them because it's cool, because kids are doing it, because they're flavored, but they're completely oblivious to the incredibly high amount of nicotine that's in them.
And we should note, for those who may not be immediately conscious, that the whole idea, right, behind these vaping cartridges was to help those who are currently smoking to wean off of that and do something else. So that was sort of the original premise of vaping, and then of course this secondary, now primary market are young people, and the CEO of Juul has even responded to these reports saying it is concerning, and they're looking, they're also worried about these findings.
I think it's an interesting letter to read what the FDA sent to Juul. They wrote a very nicely worded letter on addressing the points that had been made, and part of that, a large part of that, is the marketing that had been done towards kids.
Right, and we should note as well, I mean, there was concern because Juul's marketing has said, that goes straight into the high schools, that it's much safer than traditional cigarettes, and the FDA upset because there's no scientific proof to that at this point, and so so they're kind of in hot water about that one.
Yeah.
One of the other things, do we have any questions?
We do.
Yeah, what do you have here?
Linda is asking, she says vaping has been around for a while, so why are we just now seeing these health problems?
Okay, so yeah, Linda kind of echoing what we started out with, since yes, vaping's been here over a decade or so, but, and
that's a great question. And I don't know that we haven't been seeing them and just haven't recognized them or put the two together. And that's something I think we need to do a little further investigation on. Whenever you're looking at an epidemic like this, it takes a little bit of time to even define what you're calling this. So it took us time to define what are we calling vaping-related lung injury. And then we have to go back and look at cases that may fit that profile. So look at last year's cases that had bilateral or both side lung injury in children that didn't have an infectious cause. Were those kids vaping? I will say too, as clinicians, we didn't do the best job asking about vaping in our histories. So when your child gets admitted, we ask about smoking, but we
may not have asked about
e-cigs. About asking about e-cigs, and that's a culture shift that needs to happen.
And you also mentioned at the very top the growth too. I mean, vaping may have been around a decade, but a whole lot more people vape today than they did 10 or even 5 years ago. So populations
I think the media attention is a good thing as far as changing our culture too of medicine and what we're asking teenagers.
Okay. Just shout them out if we have any more, Lisa. Any more questions? Anything else from our viewers?
Marie is asking, she's saying kids turn to vaping as a quote safer alternative to smoking, but what are doctors and the CDC doing about smoking altogether? She says kids addicted to nicotine will go back to cigarettes.
Okay, so that's a good question. What about traditional cigarettes, and how is CDC handling that?
So there's been a lot of, I think it's difficult. Everyone knows how difficult it is to quit nicotine. It's one of the major concerns. And we can talk a little bit about the nicotine aspect of these devices, which I think has been a little bit neglected. The aspect of what are we doing about quitting smoking in this country, especially for kids. There's anti-smoking,
Sure.
platforms, and there's a lot of good websites. The CDC has a great, if you go on their site, their toolkit for teenagers and parents, there's apps that teenagers can use that can help them quit. There's like 1-800-QUIT now. So there's things, tools you can use. It's difficult. Once you start smoking, it's difficult to stop, and that's why people smoke, for years and years. And so the key is getting this under control.
And I think we should note that traditional cigarette smoking is down among young people. Stop me if I'm wrong. I think I remember
and they've
that.
all shifted to
Yes, well, and there's that. There is
Yeah.
that, but I don't know. There's a lot of moving parts here.
There's bad
but,
things in both.
Yeah.
It's difficult, but.
Something else I wanted to ask you about, and I think we're also, we're still looking for some more questions if people have them. So earlier this week, there were two brothers, I think they were in Wisconsin, and they were arrested, right, for these black market vaping cartridges.
Right.
And in their case, they were using the THC, the cannabis oil.
Right.
And the folks who have sort of established smoke shops, and they do have a vested interest, they'll say they think a lot of these lung illnesses are due to the black market cartridges. There are people who think that the cannabis oil, is a culprit. What are your thoughts on that?
So let me premise this by saying we don't know what's causing it. There's theories on what the etiology of this is, and it may be multifactorial. It may be the device, it may be the product, it may be the host, it may be all of those things combined. I think when you're talking about oils in particular and vaporizing an oil into your lung, you're basically vaporizing particulates of oil, and that's coating, lining of your lung that should be nice and clear and able to exchange oxygen. That's what's leading to what we're calling a lipoid pneumonia, which is extremely rare. So it's a question on your boards when you take boards in pediatrics or medicine that usually that's from inhaling like petroleum jelly by accident as a child. It's very rare to get a lipoid pneumonia. When you vape, you're basically inhaling lipid particles into your lungs. So that's part of these oil-based products that might be an etiology. When you're talking about black market, it's who knows what's in it. You could say that about the entire industry of vaping. It's not FDA regulated. We don't know what is in each product, which is why we're asking why the FDA is trying to test some of these products from people who become ill to try to pinpoint, is there one thing in particular, or is it multiple issues? But it's interesting. These brothers were selling up to I think 5,000 or 6,000 cartridges a day to people that they were manufacturing as a business.
Yeah, it was sort of a small business, but not really.
No, it's a big business. It's a big business. And you can also modify your pens or your devices and vape in different ways. And whether that leads to higher temperatures, creating different
reactions or particulates perhaps?
Particulates and so.
And the interesting point you also bring out is that it could be a host component, as in the smoker. Maybe there's some sort of genetic predisposition for respiratory illness, and somebody's lucky, it doesn't bother them, somebody else not so lucky, and it can be an issue.
Exactly.
Let's check in with Lisa, our producer, see if there's any other questions.
Sure.
What do we have?
We've got one from Chris. He says, vaping has been a great way for me to stop smoking. He hasn't bought a pack in years. Why isn't vaping being talked about as a viable way of stopping smoking?
Okay, so Chris is saying it's helped him stop smoking. Why isn't there more talk about it as a viable alternative to cigarettes? And that, that was the whole premise of vaping. That's why it became a product. Do you see it being used as it was originally marketed?
No. So I think the issue, there is a subcategory of people that it may be great for. And even Juul has backtracked and said it was never meant as an anti-smoking or to get you off cigarettes. It was really to get you on a different nicotine device. And it takes away the carcinogens of
The tar
what's
and
called a combustible nicotine device, which is a cigarette. The tar, the things we know are bad in cigarettes. I think when you look at especially e-cigarettes and Juul, you have to look at the nicotine content. So Juul has two different formulations. One is a 5%, which is 59 milligrams of nicotine per ml, which is equivalent to a pack of cigarettes. That's in one Juul
cartridge.
pod.
And is a pod sort of the equivalent of a pack in terms of smoking? Okay, so that's
it's user
comparable.
dependent.
Okay.
If you could smoke one pod in a day, you could smoke one pod in several days. It depends on
how big a smoker you are, or vapor you are.
The
Okay.
vapor.
Yeah.
I think what's concerning is most kids don't know there's nicotine in Juuls, and study after study has shown that if you start smoking before the age of 18, you're going to keep smoking, and smokers typically don't start smoking after the age of 18. So if you're going to smoke, you're going to smoke as
earlier.
a teen. And these products are now making that just more and more likely. So it's wonderful that it worked for Chris. I think our concern is for the pediatric population and not really knowing what they're getting into.
And so that may be different, like for adults and older people who are trying to quit smoking. This could be, for Chris certainly, it's been a viable alternative. But yeah, obviously the concern has been younger people who never did smoke cigarettes previously, starting to vape, and whether that vaping, well, the studies suggest or indicate that vapors will then subsequently, because of the nicotine, go to traditional cigarette smoking.
Right.
So.
And I think that's part of what's behind the White House's initiative of taking flavors out of these.
Sure.
You can smoke something that's not flavored, but there's no point in that being bubblegum flavor.
True enough, true enough. And yeah, I guess it was just this week too that the Bloomberg Philanthropy Group, former mayor of New York also, right, his philanthropic group has committed $160 million to fight vaping among adolescents, and they are also on this campaign to try to remove flavored cartridges. Any other questions, or are we wrapping up here? Okay, alrighty. Well, you know what? The timing is excellent because we're about to begin the 411 on Channel 11 on our, television side, if you will, and you're going to be joining them in a couple of minutes. I think Reagan Witteraj is going to come down, and we'll continue that conversation as well. But thank you very much, Dr. Arrington, for being with us. Really appreciate it. Big topic, and it's going to continue to be so. All right. We will see you next time, Facebook friends. Thank you. Ciao.